Alrighty guys, welcome to the video. Today we're going to be talking about cramping and in particular exercise-induced muscle cramps. So if you've ever had exercise-induced muscle cramps or any even general particular cramps, you'll know they're, I guess, particularly annoying. So today we're going to talk about, just a brief overview of, some of the risk factors for particularly exercise-induced muscle cramps, some of the proposed mechanisms as to why, they may occur, and then some practical strategies that you can, I guess, implement to hopefully try and minimize the risk of experiencing exercise-induced muscle cramps or even general cramps. This may apply to as well. So what are some of the risk factors? Well, extremes of temperature is number one, whether it's particularly cold or particularly hot, especially if you're not used to that temperature. That's definitely a risk factor for cramps. Rapid increases in training intensity or volume. If you've been training along at a particular level and you go up too high and the muscles just over fatigue, aren't used to it. This is a proposed, risk factor for cramping. A past history or susceptibility, some people are just genetically or just individually, more inclined to suffer muscle cramps than others. Older age, a higher body mass index, a family history, again, this comes back to genetics, and other factors associated, including chronic disease, that of cardiovascular, respiratory, gastrointestinal, nervous system, kidney, bladder, or even blood disorders, hematological, as well as other things like allergies, different medications, and history of injury. So I'll put up a nice little table. I'll overlay that now on some of the, common things which can put you at a higher risk of cramps, some of the medications, and chronic health conditions, etc. So, proposed causes of exercise-associated muscle cramps. Now, the biggest one, I guess, is just really the disturbance of, there's a couple. Really, there's two main ones. There's other umbrella ones, but generally they fall under these two. Disturbances in hydration and electrolyte balance. So this goes each way, overhydration or underhydration, so lack of overall body fluid, too much or too little, and then electrolyte imbalance, so sodium, chloride, potassium. Disturbances, if you're overhydrated, you can become hyponatremic. If you're underhydrated, you can become hypernatremic, so you've got either low or high sodium, and that's really a big one. And this was really looking at, I guess, the main theory here came from physical labor workers, and when they were working long hours, they would suffer in the heat, particularly suffer from muscle cramps, and that was resolved often not through consuming excess or extra plain water, but consuming sodium enriched water or salts alongside their water. The other one is, altered neuromuscular control. And there's a few theories here, but it's the idea that, muscle cramps are more of a neurological issue rather than being directly related to events occurring within the muscle itself. This idea of within the muscle, increased spindle activity, increased central nervous system excitability, and then that kind of inhibition of, muscle firing, so overactivity of the muscle. Other things like all related to the central nervous system, really, and we could dive into the science about how particular neurons can become overexcited and therefore, I guess, lead to a withdrawal of the capacity of the muscle to be inhibited as opposed to excited, and that can lead to muscle cramps. This all comes down to fatigue, and this is generally saying, issues with neuromuscular or neuronal fatigue even can cause cramps. But nonetheless, what are some of the prevention strategies that are talked about in the literature? So early studies really looked at this idea that consuming salty water, like we talked about before, can be a good prevention strategy. So ensuring your electrolytes are on point, not consuming too much dilute water. The other one revolving around the idea of neuromuscular problems, or this theory of neuromuscular, imbalance, dysregulation, is whereby, passive stretching can help to improve exercise-induced muscle cramps. So ensuring you're stretching regularly, but also not having irregular stretching habits, because that's, if you're someone who never stretches and stretches irregularly, that's something which has been found to kind of predispose one to the risk of cramping. So it's kind of a balance there. And then there's obviously a long history of old kind of remedies for cramping. You know, this involves things such as compounds which have a bitter or strong kind of taste, including, you know, anecdotally providing benefits, and these include things such as pickle juice, mustard, vinegar, various herbs and spices even. Of those, pickle juice has actually clinically been found to reduce muscle cramps. It was found to reduce the duration of muscle cramps in one study by 37% on average when 1 ml of pickle juice was ingested 2 seconds after the induction of cramping. So, you know, pretty interesting research there. And, you know, one thing that was noted was the intensity of the cramping, however, was unaffected. It just reduced the actual duration. So, you know, there's a few different proposed mechanisms, but one is that essentially, you know, the activation of receptors in the mouth, which are these oropharyngeal, this oropharyngeal region, and these receptors in this area resulted in a reduced firing of the actual nerves that innervate the muscle themselves. So you kind of overexcite the activity of the neurons in the mouth, and therefore you kind of, you know, trick the brain in a sense to worrying about that as opposed to worrying about the firing of the muscle, and that can in a way, you know, reduce the overexcitivity of those neurons relating to the muscle itself. But what are some actual practical applications that you can really take away from this? So, you know, there could be benefit in consuming spicy or peppery or those kind of strong tasting bitter foods before exercise, or even several hours before exercise, may help reduce the risk of muscle cramps. So you could try experimenting with things, pickle juice in particular, because that's like where the most study has been done. Obviously, with regard to training intensity, build it up gradually. You know, we know the central nervous system plays a significant role in, I guess, the etiology of muscle fatigue and cramping during exercise. And so, you know, you obviously want to minimize the impact of fatigue on the muscles to an extent. You can obviously overreach a particular amount, but you don't want to do that too soon, or, you know, stack on too much intensity or volume too quickly. The third thing you can look at is to, you know, before any kind of big event where you're going to be pushing particularly hard, is to, you know, ease up on the training intensity, make sure you're very well recovered before the event, and ensure that your muscles are, you know, you're not going in with too much fatigue. Other things, you know, strength training, or if you're really susceptible to particular muscle cramps, of, you know, strength training individual muscle groups, which may be becoming increasingly fatigued relative to other muscle groups. This all depends on your biomechanics and what exercise you're doing, but obviously this may lift that kind of, you know, improving the strength of those particular muscle groups may well lift the threshold beyond which you know, kind of are susceptible to cramping. Stretching regularly, not irregularly, but particularly the key muscle groups that you are using during exercise. That's very important. Consuming carbohydrate-rich food and diet, we know that it's very important for energy production, particularly at the higher intensities. So, you know, if you're carbohydrate depleted, you're going to be more susceptible to earlier onset of fatigue or more muscle fatigue in general, and therefore ensuring you're getting enough carbohydrates in overall is very important. And then use other things like, you know, massage therapy as an additional kind of method or approach to reducing the you know, I guess, well, more so kind of improving the relaxation of the muscles themselves and improving muscle recovery, especially after tough workouts. And then you can look at other things like other minerals like magnesium, for example. Even amino acids like taurine particularly has been involved or been researched to be very advantageous in preventing cramps. So magnesium and taurine may be something on your radar as well. You know, obviously it's a field in which there's a lot of research, but there's also a lot of unknowns. And so, look, treat the practical applications as a priority. Don't worry so much about the actual mechanisms. Obviously, you know, it's going to be an individual thing. If you're cramping due to excess fluid loss or particularly salt loss, you really want to adjust your electrolyte intake, increase it. If it's more of a muscle shortening issue where you're never stretching and then you're cramping for no reason, like there's no dehydration, you're not heavily sweating, and it's because of that, maybe stretching's more in your best interest, maybe a combination of all these things. There's some emerging research regarding like electrical stimulation of the muscle, which is quite promising. But obviously, you know, like there's a whole lot more work to be done here. But nonetheless, treat those general tips as some things which you can do to, I guess, you know, minimize your susceptibility to muscle cramps during during exercise, during heavy exercise, endurance training, or high intensity exercise as well, you know, sprinting, etc. So make sure your minerals are on point, make sure you're not deficient in anything, and yeah, I guess build up slowly and do all the right things. Keep on track of your hydration, electrolytes, stretching even, and just try and do these things consistently. And hopefully, you know, if you are heavily prone to cramping, then hopefully these things can help you over time. Remember, doing them as a one-off isn't going to be all that beneficial. You got to do things consistently, and with consistency over time, hopefully you can get some relief from some of those, you know, quite debilitating muscle cramps, which everyone knows they can be if they've ever suffered from them. So hopefully some of that information was useful. And yeah, I'll see you guys in the next video.